Health-wise, Gibraltar remains in many ways much the same as it was 8 years ago. The same bad habits remain hard to shift. While the UK has seen a reduction in smoking to 17% of the population, Gibraltar's seen an increase to 35%, up from 2008 when it was 29%. Smoking levels also remain high among young people.
Well, I think there's a couple of interesting results here. Smoking is one of them. And obviously it's a concern. Obesity is another one, which is also a concern. And what we have to do is analyze how we're going to try and influence a change in people's behavior. I think in the smoking perspective, one of the things that won't have been very obvious in the survey is that with our having banned smoking in public places, those who don't want to smoke won't have been smoking somebody else's smoke. So I think that should already be having an effect in our health. As far as smoking is concerned, clearly we've got to promote non-smoking. There is already a clinic that helps people to do this. I think we've got to go through schools as well, and education and youth groups as well, particularly at the age when people may want to start smoking. And obviously obesity is another one that we have to tackle.
In terms of smoking, is the answer perhaps to raise the price of tobacco, something that's been shown to work in other places?
It might well be, and this is something that, looking at the evidence in front of us, we need to consider whether this is a step that we should take or not. Sadly, raising the price of food will probably not make more people less obese. So that's not something that we're contemplating. It's interesting because it would obviously be a different effect. But I think awareness is crucial.
Obesity is an ongoing issue, with 60% of those surveyed overweight, the same as in 2008. However, binge drinking has been halved, and there's been an improvement in skin cancer awareness, with more people using sun cream. The survey aimed to build on the findings of 2008, identifying trends so that these can be addressed.
Well, there's obviously quite a lot of information in this. It's a 200-page book. So we need to circulate it so that people involved in implementing the findings have the opportunity to read it and digest it. We've already started putting some of these ideas into our health promotion strategy, and particularly, for example, in schools and so on. So some of the work has already started, but over time we hope that the messages from this will also come into government policies and affect how people react in other departments and so on.
401 people, selected at random from the electoral register, were interviewed in person for the survey, which saw 24,000 pieces of data analysed. Booklets summarising its findings will be distributed to households, while the full report will be made available in libraries, schools and online.